the concept of this stapler now firing so many times, measuring firing so many times a second, does that make a better staple line? Well, it makes potentially better B formation, because the pause allows the stapler to have a more opportunity for each staple to get into the appropriate anvil and make the appropriate B. But that should be something that we all do with all staplers anyway. So a better staple line could be had by a robotic stapler because it forces the surgeon to pause, even if a surgeon's not interested in pausing. But there's a difference between the pauses and the measurement. That's an algorithm, and that's a pause that's there to reduce interstitial edema and allow better staple line formation. But that's very different than the concept of why to use buttress. But the reason we use buttress is to distribute pressure, to distribute tension across the staple line. And I think people who use buttress believe in that. They believe in the concept of the washer, the concept of distributing pressure across the staple lines, because your pressure is at the point specifically where the staples perforate through the tissue, unless you have a reinforcement material such as seam guard sitting between that. The seam guard acts as a washer. It distributes pressure, and a stapler measuring 1,000 times per second or pausing does not change the distribution of pressure with use of buttress. So I do not believe in the argument that because this measures 1,000 times a second, I no longer need to use buttress. The purpose of using buttress is to distribute pressure. The purpose of the pauses is to allow good staple line formation by allowing time for interstitial fluid and edema to come out of the tissue. So they're two independent things. They both have their own advantages. And the fact that someone says, well, we measure so well, you don't need to use buttress anymore, that just doesn't ring true with me at all, because the purpose of the buttress is to distribute pressure.